Hello and welcome to the World Built Environment Forum webinar series. This webinar comes to you with the support of Colliers International, the forum's premier partner, and our executive partners Glodon and Shanghai Oriental Investment Supervision Company. My name is John Krause, and today we're discussing the livable city, smart, stable and healthy. Over the next hour, we'll be looking at what recent events tell us about the ingredients for stability in our cities. We'll ask how data can help enhance livability, and will social distancing erode livability? And what should a city livability strategy include? We've assembled a wonderful panel of experts to help us through these questions. And firstly, I'd like to introduce, based in Copenhagen and joining the forum for the first time, Helle Sørholt, founding partner and CEO at Gale Architects. Welcome, Helle.
Thank you very much. Very pleased to join you.
And also joining us today from Washington, D.C. is one of the forum's great friends, Billy Grayson, Executive Director, Center for Sustainability and Economic Performance at ULI. Good to have you back again, Billy. Welcome to you.
Thanks for having me, John.
And completing our lineup, bringing a wealth of insight from the surveying profession, is Tim Neal, President of RICS. Welcome, Tim.
John, thank you. Great to be here.
Thank you to all of you. And now there's about 300 people who will be joining us today, and we also always welcome your active involvement. So do please submit questions to our experts. It's very easy to do so. All you need to do is to use the question box on your screen, and we'll pick up as many of your questions as we can as we go through the session. So without further ado, let's move on to our first topic, which is about stable cities and how they are able to function at high capacity during times of severe disruption. So Billy, I'm going to ask you to open the discussion on our first question, which is really, what have the events of 2020 taught us about levels of civil and economic resilience in our cities?
Well, thanks, John. I think that's a great question. And I'd like to note that I'm coming to you live from my dining room this morning here in Washington, D.C., where in the U.S. we're experiencing the first steps of our second wave of the COVID crisis. And we're seeing, this has been an interesting year. It's a really interesting stress test for how cities approach resilience, especially since this was an unexpected shock to the system. And to use the Rockefeller 100 Resilient Cities terminology, this is both a shock and a stressor to our city's infrastructure and our economy and our social fabric. So like a natural disaster, cities have had to stand up new services for their citizens, like expanded food banks, hospital beds, testing clinics, financial support programs. They've had to redesign their urban plan and infrastructure temporarily to manage these impacts. Everyone working from home from 3 to 6 months, all restaurants are moving outdoors, all streets have to be safe for local businesses, and in the US for the protesters. We're going through a very important discussion about racial justice in the US, but it is coming at a time of COVID, which really complicates cities' response to both of these issues. It's hard to say whether the pandemic and these protests have shown that cities are more resilient, as these events have hit some cities harder than others, and they're hitting in ways that don't seem to be aligned with the city's level of preparedness, the ability and the resources to withstand and bounce back from events. We've been communicating with some cities who seem to be getting it right, who are poorer cities like Medellin in Colombia and Hanoi. They've had great success in managing COVID with minimal financial support and infrastructure. And we've seen really well-run and wealthy cities like New York and Seattle and San Francisco struggle with these impacts. I think the one thing that we can tell in terms of the cities with a strong resilience strategy is they're bouncing back a lot quicker than the cities that are experiencing either a constant wave of COVID-related economic stress or a bounce back. And one last thing, I think that the COVID test on resilience is also showing how connected we are, that no city is an island, and their success in managing through these crises and being resilient is dependent on the support they get from subnational and national leaders. Here in the US, the cities that are doing the best are the ones that are working well with their counties, their state, and the federal government. If the state is supporting the measures the city's taking, or at a minimum isn't blocking the policies that run counter to local measures, those cities are able to better withstand and bounce back from these extreme events. And we've seen globally that governments who've made meaningful investments quickly to support the most economically vulnerable people in their country and businesses in their communities are finding that their population and their businesses are in better shape economically to weather the shutdown and a downturn, and better able to follow the rules necessary to flatten the curve and beat down this pandemic.
Thanks, Billy. And I think you put it really well. 2020 is really the stress test of all stress tests, if you like. And we've got this whole concept of shock and stresses at the same time. I just wanted to pick up on something you said, which I thought was really interesting. Medellin, Hanoi, cities you said that were not particularly well-resourced, one might assume not particularly well prepared, maybe that's a false assumption, yet doing well. In contrast to New York and San Francisco, no shortage of resources, one would think, not doing so well. So why is it that cities with relatively few resources have been able to be resilient, more so than the well-resourced cities?
So I think it's important to say that I don't know all of the details about how Medellin and Hanoi prepared for this sort of a shock in advance. But what we did see was that their mayors reacted very early and decisively to the impending threat that they saw affecting other global cities, and implemented measures that were able to flatten the curve a lot faster than many of the cities who already had the disease active before they recognized the need to develop and implement those policies. I think another challenge that is unique to the US, well, maybe not unique to the US, but definitely something that we have to navigate through is our federalism, and the fact that, you know, cities, states, and the federal government may have very different approaches to dealing with a shock or a stressor. And that can complicate a city's autonomy and ability to effectively implement the policies necessary to quickly deal with a shock or to mitigate the impact of a stressor.
Thank you. And in your answer to the previous question, you alluded to the social unrest that is particularly present in America. So in other words, the Black Lives Matter movement that's arisen from reasons of clearly police brutality and unequal treatment of minorities by the police. How has that interacted with the COVID crisis? Has it in some way exacerbated the problem? Has it perhaps made no difference whatsoever? What's been the interplay there?
I think that the impact on deepening the COVID crisis has been less than people thought. There are some cities that are dealing with a significant amount of impact on traffic and property destruction, but the biggest impact that's come out of these Black Lives Matter protests is a very positive one. I think cities are becoming more aware of the inequality that has existed, and especially how it's impacted communities of color. And this is leading to cities having a social equity lens when they're thinking about their resilience strategies more and more, and recognizing that if you can help improve the access and the ability for economic mobility in the most vulnerable populations, that when events like COVID or natural disasters hit, you'll be much better equipped to bounce back from those events. And I think that there is going to be a continued investment in social equity as a component of how cities approach their resilience strategy, which I think will make them more resilient in the future.
Thank you. So I'd like to bring Hella in then to build on some of those points, because points there around resources and whether they are an indicator of likelihood to be resilient in the light of the pandemic and similar stresses and shocks. This idea of the social equity lens and how you can use that to be more resilient. What would be your view on all of this, Hella?
Well, we have actually made a lot of different surveys in cities here in the spring under the lockdown. And what we have seen is a tremendous, you could almost call it a revival of the neighborhoods. Obviously, a lot of traditional city centers where shopping and businesses have been closed down, activities have dropped between 60 to 90%, whereas the activity levels in the neighborhoods have grown with up to 35% or more. So the cities that are doing best are actually the ones that have great social connections, great neighborhoods where people are helping each other, knows each other, and we've seen sort of across some of the cities we've surveyed, for example, Facebook groups or other social network groups where people are now offering support to community members that are vulnerable. So I think this this sort of new localism, you could say, will be one of the things that we can strengthen in our resiliency strategies in the future. We've also seen that the cities that have multitude of different, for example, infrastructure systems, cities that already have good walkability systems, good cycling networks, good public spaces, and so forth, are also doing much better than the ones that are only dependent on one system, like for cars.
That's interesting. And perhaps I can throw in a thought that Nick Turner, who's contributing from the audience on this, he's saying, essentially, surely it's now the time to mix our shopping streets once again and encourage a complete mix of all residential and commercial space requirements. So how, bringing a much more, if you like, interwoven fabric of commercial trade and residential back into what were perhaps only shopping areas in the past. Is that part of what you would call the new localism agenda, Hella?
Absolutely, yes. I think that is what we now see. People are still working from home to a large extent. So we need different kinds of services in our neighborhoods, and definitely the traditional shopping centers or the downtown shopping areas that have been redundant in this area or this period certainly needs to be mixed up more. So mixing of functions in neighborhoods and urban districts is going to be part of the resiliency strategy and planning moving forward. And as well, sort of making the cities greener and ensuring access for all to public space. Because public space as a human right is something that I have been advocating for many years. But I think during this pandemic, we have all felt on our own human bodies what it means not to be able to go out and how much we actually need fresh air, access to public space where we can be physically active and meet other people.
Thank you. And I'll just add, Tina Payet in France is referring in the questions about 15-minute city of Paris, which the mayor of Paris is talking about as a good example of a localized city. So I'm very much building on what you're saying there. Let me bring Tim in now. So Hella mentioned human rights and as being important in cities and how we plan them and arrange them. Not something you would think that surveyors would think about very much, or do they? To what extent are surveyors looking at these social and human rights concerns of real estate?
Yeah, thank you, John. Well, actually, we're looking at it through, I think, several lenses. If you look at the health of a city, it needs to be physically healthy for the citizens, but also, create a good mental health environment. But as has already been mentioned, it's got to be socially healthy as well. So social equity as well as economic health is really important. I would say, you know, from an RICS and a profession perspective, we're all having to take a hard look at, you know, the recent events and go really on the front foot as leaders to understand more about systemic racism and understand where it does or doesn't exist. And I think just understanding more and learning more and asking those questions and seeking feedback and guidance from colleagues about their experiences is really healthy and helpful. And you know, our CEO Sean has gone out and led on this strongly, and I think having that dialogue across the profession is really important, because we're not going to be able to have healthy societies unless we build equity across all of our professions as well that contribute to the built environment.
Thank you. I'm going to move on to the next question. I think some of those points about well-being will actually come up later on as well in the conversation, so we will pick those up further. But our next question, I'm going to bring Helle in to lead us on this, because Helle, you've got extensive experience in cities all around the world, from Cape Town to Kuala Lumpur and Vancouver and London in between. What would you say about the role of data? You know, are we able to enhance data, or to harness data rather, to enhance livability? And are there any risks associated with doing so, for instance, perhaps with an overabundance of data? Can we use data? Are we using data for better livability?
We can definitely use data, and there is, as you are already alluding to, an abundance of data already. I think too many cities and organizations, they have so much data that they don't know necessarily how to analyze it or find the patterns. However, I think this crisis that we are in right now is showing us that what we need, we don't necessarily have all the data we need, because we need more public life data. We need data that can tell us more about people's needs and their behavior. And I surely believe that smart cities is people cities. So what I think we need more data on is the type of data that can make all people more visible, so that we can actually more appropriately respond to people's needs. And we need, as Tim was also saying, we need to work harder to make sure that we have that people are actually represented in the data that we are currently collecting, which is not always so. We have socioeconomic data, and we have teledata, and you know, sensors in so many places that are collecting all kinds of data. But we need to be more specifically looking into whether people are actually represented in our cities, whether all people are visible in public space and are moving freely around our cities. And that data we need to be analyzing more carefully.
Thank you. I'd like to look at that a little bit more detail. Matthew Dennis is asking online, you know, to what extent can you actually rely on data? Is there a risk of a bias in the data because you've excluded certain groups, maybe the very young, maybe the very old? And isn't data really just a snapshot in time? You know, does it really tell you about the needs of tomorrow rather than simply what one is observing today? How can we make sure the data we're getting is truly as diverse and inclusive as it needs to be, Helle?
Yes, I mean, data is truly a snapshot in time, but it can also show us something about trends and development over time. So if you think about data as something that you monitor over a period, it can actually show you how cultures are developing and changing in our cities. But far too many cities and organizations are not necessarily collecting the same data sets over a long enough period of time. So so I think data can be very valuable if you actually look at those trends. Equity, however, is a real issue, and data can be very selective. So it's very important that we use different data sets, and that we also go out into the cities and into the public spaces and meet people where they are, and not just rely on what we can see in a center or read on an Excel spreadsheet or something like that. You have to actually go out and meet people where they are, and also collect some of that, you could say, more lived experience data or personal data, where you get a broader picture of who is actually present in the city, who are represented, and in that way get a more complete picture of what is going on.
Thank you. And just a quick comment for our listeners. Somebody's asking, are there any slides? The only slides we're showing are the questions themselves. There aren't any additional slides. So Hella, can I just try and maybe tie together some of those things you were saying? Because in a way, we're talking about lots of different types of data, but are we really answering the question about which data we really need? So is there, for example, a set of metrics that define a livable city? You're an architect. Do you have some metrics that you work with on this?
We do, and there are lots of different indexes that measures livability in different ways. We, from our part, are looking very much at access to outdoor space. We, especially in urban areas, it is very important to have that access to green, to water, to outdoor facilities. When we sort of in this period have all been so focused on health, you could say that human lives is something that and human life and life between buildings is a parameter, an umbrella, you could say, that includes everything from mobility to health aspects, to physical activities, social activities, and so forth. So that is the one metric that we are measuring as an indicator for livability. How diverse is the public life in a certain place? How inclusive is that life? Is everyone and every age group, for example, represented and visible in the city? Those are some of the simple metrics that we use, and that I would argue goes across globally when we look at these different livability indexes.
Thank you. So let me bring Billy in at this point, because Billy, ULI work with cities. Just is there a city ULI doesn't work with? I doubt it. What would you say were the kind of metrics that you're seeing are important to gather? And not only that, are we actually gathering them smartly, or have we still got the problem with organizations as collecting subsets of data that if we all perhaps teamed together and collaborated a bit more, we could make better sense of? What do you think?
Yeah, I think data collection in the service of smart cities is still really in its infancy. It's really challenging to find the right key performance indicators to measure whether a city is becoming more livable, smarter, or healthier. And we've entered into some very interesting debates about the value of data to make us more efficient and effective versus the concerns over privacy. And I think that'll continue as we're able to collect more data to try and solve some of our city's challenges. So it's going to be a constant tension. And we're seeing, especially with this discussion around contact tracing with COVID, it's a way to make our response and our resilience more efficient and effective. But at the same time, in many countries, it's bumping up against privacy concerns. And it also brings up social equity concerns. If our best tools are sensors and cell phones to collect real-time data, The sensors only pick up people who are moving through and interacting with the space, not the people who don't have access or high quality access to that space. And cell phones only pick up information from people who have cell phones. So it can create equity concerns as well as the active privacy concerns and discussions that we're having.
Thank you. And maybe I'll bring in Tim then to respond to this, because you know, in the surveying profession, there's a lot of data. You know, we have lots of data from buildings with sensors built into them, can tell you how a building performs. So that's interesting. Is that able to gather data for us, which gives us clues about livability? And secondly, I think, Tim, this is a question from Matthew Dennis, I think a very good one. Who actually is in charge of evaluating those data? Because, you know, we all have our biases. Maybe it's bias of politics or bias of background. You know, are professionals sufficiently well placed to be able to treat data about very social, very human issues in a way that is completely, if you like, objective?
Great questions. Great question from the audience as well. So thank you. I mean, for me, there's two aspects to this. One, I think what both Billy and Hella are drawing out is that looking forward, we really want to gather much more, I would call, soft data about the human experience of city dwelling urban life. And I think that's quite a different data set to what we've gathered hitherto, which have been typically hard data around, you know, physical infrastructure and the use or non-use of assets and their connections and linkages and time and space. And there's been a lot less about inclusion and youth and how places make people feel. And I think, you know, we're beginning to see happiness indexes, etc. And I think that's an important direction of travel. And I would say, you know, one of the big learnings from the COVID crisis is that society's come away with a heightened sense of what is really important, you know, health, well-being, nature, just to name three. And that's really the lens that everyone's looking at the future of livable cities through, I think. In terms of who best and who most capable to manage data, the RICS has looked at whether construction professionals are really well equipped to work with data or not, and there's been some survey work done on that. And historically, I think surveyors would feel very strong around data and the ability to use it and offer judgment and insight based on it. But there's also great recognition that we need more and advanced skills and better education, better understanding, and the ability to assure the use of the data in new and better ways. You know, I'm seeing this all the time. Hella mentioned there is huge amounts of data available, but how to structure data in a way, or use unstructured data to create valuable insights is a real skill in its own right. Knowing what questions to ask and then being able to validate whether they are indeed correct inferences, and then having the ability to assure that so that people can trust it. You know, we all know about fake news, and I'm constantly amazed by the number of data checks and, you know, trust checks that go on, whether it's a news article, you know, testing whether the president or the prime minister has told the truth in the facts and data that he shared. You know, in some ways there's a low level of trust at the moment, but on the other hand, there's a great deal of transparency around fact checking and trying to build trust and build assurance around data. So I think we're moving in the right direction, but there's room for more skilled development in that space.
Thank you. I'm really pleased you mentioned the validity and the assurance there, because one of our audience members, Clive Majura, is asking exactly that. You know, validity of data is also a cause for concern. How best can it be validated? And I think you've touched on that, and we might come back to that in a bit more detail later, but I think that's a really great point. You also mentioned in your comments there, Tim, people starting to realize what really matters, if you like. And you mentioned nature, you mentioned health. And that takes us very nicely onto our third question, which is that the COVID-19 pandemic has brought public health to the top of the agenda. And Tim, I just wonder, is social distancing in any way an impediment to livability? And if so, what can we be doing about it?
So thank you, John. I think, there are many areas where our lives have been disrupted by both the actual health crisis, COVID, the policy actions at national and city level, and also the unfolding economic consequences and responses to those. But if you look at livability, I think it's really is a question of priorities, and it places the human experience of individuals and communities right at its heart. So it's a choice around priorities. I think that our future urban spaces can be as livable as we choose to make it, even under any remaining social distancing restrictions in the future. I think the key is that human experience needs, environmental needs are given proper importance, and they're balanced with, the necessary imperatives to drive productivity and have a productive workforce and deliver appropriate returns for businesses within a business environment. So I think balancing all of that is really key. I would say I think the response in the built environment across professions and industries to the current crisis has been really remarkable and strong. I think it offers lessons in how people choose to prioritize social impact, actually individually and collectively. And when we do that, we achieve amazing things. We've seen great innovative responses to both the lockdown and social distancing. We've seen essential services delivered continuously, refreshed activity to make that work. There's been, great use of technology, allowing projects to continue with modelling and management offsite remotely. And actually, really importantly, great collaboration across disciplines to continue to deliver critical infrastructure in record time. So, I think, and even if you look at the return to work activity that's been really intense around remodeling spaces, the design, signage, compliance piece, all about delivering safe working environments, COVID secure, has been a huge collaborative effort. And so I think it's been great adaptation by professionals through it. The RICS has had a good role, I should say, in supporting that. Really clear thinking frameworks have been provided in the reopening up guidelines. So, perhaps to summarize, I would say two aspects: innovative, collaborative professionals who embody high standards, working together around delivering positive social impact is a great thing. I think people want to do that naturally. And I think if we keep channeling that, we've got a real good starting point for a much more sustainable, livable future in urban environments for everyone. And, I see much of this as adaptation for resilience, actually. Billy mentioned it, Hella's mentioned it. The Sustainable Development Goals speak to resilience, and, we're having to develop new resilience around livabilities. I would also say, perhaps we'll come on to this, but I'm very struck by the fact that, many of the future models for livable space are going to fall to great designers like Hella to help bring them to life. And there are some key assumptions being made in some of the early work that I'm seeing, where people are looking to a future with a vaccine and social interaction and taking the learnings from this COVID crisis. And I think that's quite exciting.
Thank you. And to anyone listening, I think a question for all of you is, the experience that Tim is describing there, is that what you're seeing in your cities? Are you seeing the impact of professionalism, collaboration, bringing great innovation, adaptation to the current situation, while also ensuring proper levels of compliance with health and safety requirements and so on? Tell us whether you think that's happening in your cities. I'd like to bring Hella back into the conversation. Hella, I've got a quote from you that I dug out from somewhere. I found a video of you, and you said, the solution to urban diabetes is not medicine, it's urban planning. What did you mean by that? Can you tell us a bit about that?
Yes, that's right. Well, I really think that the way that many cities have been designed until today have made us all very inactive. We are basically sitting behind computers in offices. We're using our individual cars to drive back and from work. We are using the elevators and the escalators to avoid stairs. And we basically eat too much processed food. So what we really need is to consider how urban planning can help us live a healthier and more active life on an everyday, where it is easy and intuitive for us to walk and bicycle and choose the stairs or have access to healthy food in other ways than we do today. So that's basically what I meant by that quote earlier. And I really think that I hope that some of the big for sure in Copenhagen and the other cities where our offices are based, we have seen this very innovative and quick collaboration. But I also hope that some of those systems that have been very quickly implemented in terms of outdoor seating, more bicycle infrastructure, spaces for walking that has been quickly implemented, outdoor activity zones and so forth. I really hope that some of that will remain after we get out on the other side and we presumably have a vaccine, because then we really need to have the political courage to make some of those designs permanent, because otherwise we would go back and we would be back at some of the high levels of air pollution and other things that we've had earlier.
Thank you. And it's interesting, this idea of, can we just keep some of these good practices that we brought in during COVID? And if one reads and believes everything one sees in the news in the UK at the moment, there's plenty of instances where councils are seeking to make permanent some of those bicycle lanes they brought in, and the local residents are saying, no thanks, we want to go back to our cars. So it's by no means certain that we will be able to make these changes permanent in a way that's very straightforward. And I'd like to bring Billy back into the conversation, and also to flag something that we learned from our earlier conversations on WBEF. We had a recent poll in which 56% of our respondents agreed with the statement that the age of regularly commuting on crowded buses, trams and trains is over. So a majority of people saying, we're not going to return to being on these crowded public infrastructure, public transport systems. Does that resonate with you, Billy, and what you hear with your ULI network?
So yes, it does, and I think that there's definitely, especially in the early stages of the COVID pandemic, a discussion about how this could lead to the death of public transportation and ultimately could undermine the densification that we've been seeing in cities over the past 10 years. I think that there's a real risk of this, but I do think that it's also possible for all of us to work to overcome some of the headwinds that we're seeing. Short term, I think it means that we're going to have to quickly make public transit as safe, healthy, and attractive as possible, so that as we are returning to work, we are feeling comfortable and safe using it. You already see in many Asian cities, they have seen a relatively fast return to public transit because it's so integral to their way of life in cities, but also because they figured out ways to make it safe, clean, and attractive to bring back the commuters and other folks. It's, this is also a social equity issue because public transit is relied on by some of the most vulnerable people in our cities. So figuring out a way to subsidize public transit and will help continue to make it an attractive low-cost solution to help some of the more vulnerable populations in our cities. But this isn't going to happen organically. I think it's going to be a proactive effort by the public and in some cases the private sector to try and make sure that we can continue to make progress with our public transit so that as soon as possible we'll feel safe riding the bus or taking the train again.
Thanks. Could you perhaps just elaborate on a couple of examples? You're saying that cities in Asia in particular have managed to find ways to allow public transport to be safe for reuse and the importance of that for social equity. Can you give a couple of examples of what's worked well, how they've done that?
Yeah, I would say that, Seoul, Korea, Hong Kong, Singapore have all seen a pretty vibrant public transit system, even after the worst of COVID hit those areas. I think there were a couple of things that they did right. One was they flattened the curve. Flattening the curve really does help make it easier for people to feel safe on public transit. The second thing is just making sure that everybody's wearing masks. The third thing is having very visible cleaning. So not only knowing that the surfaces are safe, but actually physically seeing people making sure that those are safe for passengers is a good way to restore public trust in that infrastructure. I think all of those things have contributed to them seeing a reasonably quick uptick in ridership after the worst of COVID had passed in those areas. And I think it's building long-term trust in that public infrastructure. I think, to Hella's point, it's also collecting data. Those countries are better at contact tracing, including how and where people are using public transit. So they're able to demonstrate how low the risk has been in most instances of using that public transit in terms of transmission versus other places where people could contract COVID. And I think that data also helps build the public trust, and being able to track that information helps the people who are working to respond to COVID to more effectively stop the spread of the disease.
Thank you. And it's an interesting idea because people, generally speaking, are a bit wary of data being collected and the infringement on their privacy and their civil rights. On the other hand, here we have an example of where data is enhancing public trust, which itself is a public benefit. I'd like to bring us on to the final topic to round off the session, and really try to bring all the points together. And I think most people listening will have heard of the cliche that generals were always preparing to fight the last war over again. In other words, they failed to anticipate future conflicts, possibly of an altogether different nature. And so could we make the same mistake with COVID? After all, the next pandemic could be of a very different nature to COVID. The next big threats may not even be pandemics. So how do we avoid too much of a COVID bias in our livability strategies? I'm going to ask Hella to lead off on this one, because you're particularly an advocate for compact urban form and cities on a human scale, and I wonder if that is part of how we avoid too much emphasis on COVID and fighting, if you like, the last battle.
Well, I think much of the urban quality discussions we've had for the past decade or so are just being further enhanced by COVID. But we all know that it's common sense for cities to be more compact in order to support environmentalism. But compactness doesn't mean to be it doesn't have to be tall and people not having the right to outdoor space. We can still plan those cities to be green and have nature and allow people to have access to both space and opportunities. So I think health will just be one extra parameter or element that we will have to take into account into our design and strategies moving forward. I think at this point, I hope that human lives and human aspects and you could say culture in cities have become even more front and center, both because of the equity discussions that are happening in the US and all over the world right now, but certainly also because of COVID. But I really hope that culture can be more of a driver for the urban form discussions, so that we can balance the hard and the soft, as we have been discussing throughout this past hour.
Thank you. And just to throw in a question from one of our audience members, Maggie Pang, she's really building on some of those comments and saying, well, do you believe that there might be inherent tensions between livability and economic access? And if there are, how do you use urban design to overcome them? What do you think about that, Helle?
Well, I think livability has to be for all, and it doesn't help if we only improve the city in the inner cities or in the wealthy neighborhoods. We have to work on developing those qualities of spaces that I'm talking about in all of the various cities, all parts of cities, so that everybody has access to those opportunities, access to infrastructure and jobs and education and so forth. I think it's very important when we talk about cities and economic development that the physical aspect of planning doesn't stand alone. We have to work and continue this very cross-collaborative approach that we have been talking about this past hour also, so that we can improve access to jobs and education and opportunities as one of the parameters, when you also improve the physical aspect of neighborhoods in terms of houses and spaces and so forth.
Thank you. And maybe just one more very quick question to you then, Helle. You're a professional, you're an architect, and a lot of what you were referring to there was about cross-professional interaction and collaboration. From the architect's perspective, is collaboration between and across professions working well in your experience, or are there areas where we could be improving?
I think we need a lot of improvement, and it's not just between architects and social scientists and so forth, but it's certainly also between public and private sector, and it's within the public sector itself. We see too much siloed decision making still, and too much sort of decision making and management in silos, particularly in cities. So that, I think, is going to be the #1 challenge in the next decade to overcome many of those hard problems that we need to deal with in urban areas. We have to find ways of overcoming those barriers and, in fact, be able to collaborate across health departments, planning departments, transportation departments, educational departments, and so forth, in order to work much more at a complete sort of service level at a neighborhood scale in the future.
Thank you. And Billy, your thoughts on this? I mean, you and I spent years encouraging the exchange of knowledge, information, expertise, and experience. between professionals and between cities and city leaders. What would your take be on the need for improvements in that collaboration?
John, you mentioned that there's a risk in planning for the last war. And I think in this case, planning for the last war actually helps us fight a current war that we're losing, which is the health crisis that we're facing globally. This is one of the most persistent stressors that hurts our ability to be resilient. And while COVID-19 really is just putting a focus on infectious disease, it's leading to a much broader discussion of health and some really positive outcomes, at least in the short term, with our urban planning. The US is trying to emulate Europe and become a cafe culture all of a sudden, and that was something that really didn't exist, and it was born out of necessity as restaurants are looking to survive the economic impact of COVID-19. We're blocking off streets to make our cities more walkable and bikeable as we find it safer to be outdoors. And I think all of that is going to lead to better health outcomes in our cities, and hopefully we'll make some of that permanent. As people interact with these new spaces that they have access to, I think that there will be a stronger consumer demand to keep these places in their more healthy and active status. And then it's going to be a conversation between the private sector and the policymakers who have allowed this to happen short term to see if they can make it better and make these investments in the long term. So to Hela's point about cross-disciplinary collaboration, I think you need the consumer demand to force the public and the private sector to get together and make these improvements that we've made temporary more permanent, and figure out a long-term financing strategy to make them vibrant and make them accessible to everybody.
Thanks, Billy. And this is picking up on and reflecting a comment that Vishnu Rai has put onto the chat box, which is the importance of sustainability in the built environment. I think all of the issues we're talking about here are bringing much broader sustainability dimensions to the built environment than perhaps have hitherto been discussed. And of course, this whole point about collaboration is in fact what SDG 17 is all about, joint working in order to achieve the outcomes on all of the other SDGs. I'd like to give the final thoughts then on this to Tim Neal, President of RICS. Tim, collaboration between professionals in order that we are learning all of the lessons we need to learn so that we can be prepared for all of the future challenges, getting away from the silo decision making that Hela was referring to, making sure that surveyors are talking to engineers, talking to architects, talking to planners, and really making the whole life cycle of the built environment as sustainable as it can be. What would be, what do you think the outlook is for that, Tim?
I think you summarised it really well, John, in terms of what's needed, and I really believe it's happening. Actually, I see, the solutions of the future, the creative problem-solving skills that are needed, come from great collaborations of all of those disciplines and stakeholders that you just mentioned. Avoiding hollowed-out cities. I had a call recently with colleagues around the world where all of them were describing the fear of CBDs that were deserted, city centres with no activity, corporates not moving back into offices, big problems. Avoiding that by collaborating as professionals with public and private planners and bodies and authorities and investors, owners, occupiers, understanding the learnings from COVID that will endure in a vaccine world, because I'm very sure that we will end up with vaccines and there will be social interaction, but there are going to be some enduring changes, I think. This mass commute in and out, the rush hour, I think that's probably a thing of the past. We're going to see much more flexible ways of working. People know that health, well-being and nature is really important. They really appreciate their local trades and this authentic community spirit that's been rediscovered. And we've heard mention of the rediscovering neighborhoods. And I think people know, whether this is political leaders, corporate leaders, essential key workers, surveyors, architects, designers, we all understand now what's best for our body, our minds, and our business. And I think, you know, a refreshed approach to live work accommodation with a stronger lifestyle ecosystem, that vision is becoming clearer by the day, I would say, with great thought leaders like Billy and Hella contributing to this, and professionals, I think, really want to go after that and deliver that. We mentioned social impact. It's in all of us. We all want to help make a difference. So I'm feeling really good about it. Thank you for asking.
Thank you, Tim. And before I close, I'll just add in a couple of comments, again from Maggie Peng, who's talking about the importance of involving the voices of all the people, if you like, in this decision making. And I'm sure that professions are doing that. Tim, your comments certainly suggest that's the case, and I'm very confident that Billy and Hella would say the same. But a reminder that we've got to continue doing it, because listening to the people is really going to be a test of or a key to getting it right. So that's, I'm afraid, all we have time for today. Many thanks to our panelists. Firstly, Hella Serhalt, founding partner and CEO at Gale Architects, Tim Neal, president of RICS, and Billy Grayson, executive director, Centre for Sustainability and Economic Performance at ULI. A reminder to everybody that we will be publishing a recording and a written summary of this webinar online, and do please feel free to go and listen to that and read it, and to share it with your own professional networks, adding your own thoughts and conversation points to that. Please also take a few moments to let us know what you thought of today's session by completing the online poll, and that appears on your screens at the end of the webinar. Our thanks, as ever, once again to Colliers International, the forum's premier partner, and our executive partners, Glodon and Shanghai Oriental Investment Supervision Company. A reminder that you can all follow us on Twitter, on Instagram and LinkedIn, where you can receive news of upcoming webinars and catch up on any you may have missed. And something new to announce. If you're a fan of podcasts, we have just the thing for you. Take a look at our new podcast series, have a listen, tell us what you think. Finally, you can download the WBEF app from the App Store or Google Play. Thank you again to everyone who's joined us and invested an hour of your valuable time with us today. And until next time, goodbye.